It's not the pilot that you should be worried about, it's what happens after. Many innovations pass the demo phase, getting people super excited. But then retention is not there after the initial adoption. Then what happens? How do you ensure that it's not constantly chasing to lock down the next contract, but it's the customer journey and the implementation phase? That's where you get the strong champions to continue to help you push your impact forward. Stay tuned. Welcome to Provider's Edge, the podcast that helps healthcare entrepreneurs and innovators break down barriers and control their business, life, and future with valuable action steps. With me, your host, Sabrina Runbeck, a recovered clinician and a business deal catalyst. Let's rewrite the rules and create a positive social impact while increasing your profitability. Everyone has this idea, right? And then you're already jumping in.
Yeah.
And then when you're jumping in, we haven't really figured out what each of our own gaps, wishes, right, challenges. And a lot of time when we build solutions, it's like, oh, we can do everything, right? This can have 10,000 applications, pathways, or whatever. But we're saying, okay, you can get there in 10 years. What about the next 6 months to a year? Right. Where are we now?
Right. So, and that was our guiding principle. So the triage, the point that we got to was, and again, nurse input really helped clarify that. And prior to me starting vCare with my founders, Sanjeev and Johan, I still own a company called Family Care Space, and I built a memory care community. So, and operated it and put in a real-time system, first ever. And then I created a digital twin of a healthcare system, of a healthcare facility, and focused on memory care. And tremendous knowledge, learning from that. And it's practical. It's in the trenches. You know, it's the richest learning possible, I think, you know, and you can experience it. So all that foundation brought me to how are we going to deploy this robot in a manner and have it with the right infrastructure to really bring meaningful help. And so we call it a point of care. And one of the things that CC can do, CC is the name of the robot, care companion, and all the nurses have gendered it, so it's a she. So I was, you know, not an it. It's and it's a very important part of how they'll do their work. Currently, when they're going to do assessments and they're rounding, they have to push in a computer cart.
Right.
They have to usually have a stack of vitals that are on another device that they got to bring in, and then they turn their back, typically because of the way the cart is, to the patient, resident, and they start filling out the form. Might get a couple of contact moments, eye to eye, but they got to go to the next one, and away they go. Later in the day, they have to take all those notes and get them into the EMR, and this whole time period is problematic for error, and it takes about 50% of a nurse's day. An interesting statistic that I think it directly relates to this bad situation, because it isn't good. 50% of nurses that begin their career leave nursing within 2 years.
Yeah.
It's not what they were trained for, right?
Right.
They're glorified, you know, clerks, and that's not delivering care in the way that you would like, anyone would like. So what we did was we said, how can we do this better? How can we make this better for the nurse? How can we help the nurse have more time to have the eye contact, really get to know who they're speaking with, and not have that administration burden waiting for them at the end of the day when they have to put all that stuff into the electronic medical record system. So we looked at CC's capability to follow. That's inherent in the robot's capabilities. So you tap the head, the CC will follow the person that has a 3D LiDAR, which is basically it can capture the image and follow that image. And it's been in healthcare. There are about 3,000 of these robots in various settings. But CC and with our configuration is brand new. This show, we're releasing our point-click care integration part. So here's what happens with the CC world. The nurse goes in the room, CC's following behind her, There's no computer on wheels. There's no separate vitals. With CC there, the nurse would hit, first of all, we have 3D facial recognition to verify that's the right person. Pull up the patient's chart, start a pain assessment, and have a conversation. So it's basically start recording.
Yeah.
So it records the conversation, stop recording when that's done. It then takes that data through our algorithms in a very deep medical model, comes back and puts that pain assessment report on the screen so that the nurse can validate that it's fine or make adjustments. And I'm really impressed. We're running about 95% accurate.
Nice.
And the nurse then can make any adjustments and then submit to the EMR. And our first EMR is point-click care. And so that data goes into the EMR. Next resident. Also, vitals go directly into the EMR. So that session doesn't have hanging over it, 3 hours of paperwork or whatever. And in fact, the reality, and Rachel can speak to this, you probably can validate this as well, many nurses don't even do that. When they go in the room, they'll have their own notes, their own thing, and they'll just, they know, and they'll give that to the next shift. But it's not really getting into the EMR or not correctly or totally. But it's out of survival mode because we've got all these people we have to see. And we just can't, or the computer on wheels isn't available, and, there's a variety of things there. So in our workflow in this scenario, CC is delivering at the point of care for the nurse, collecting these data points, which is the most important. Think about the chain of data and what that means to all these other systems, payment systems, care systems. If it's not correctly collected at the point of care, and right now it's problematic, they're prone for errors, etc., then many other things don't make sense, or they can be, and that can amplify in terms of issue. So we have a very solid environment now that can go with the nurses. Other capabilities, it has telepresence. So for example, I could be in a nursing center. I might have 20 patients I have to monitor. If there's an alarm or an alert going off, I can send CC to that room, and I can see through CC's head and move the camera around and check out if everything is okay, or if I do need to have someone dispatched to that room. I can use it with respect to therapy in the home. So if somebody's recovering from a hip injury, I want to see how they're moving. So I could be a physioanalyst in my office, and I send CC to follow the movement of this individual's walk, to check their gait, how they're improving. And it moves with them. It's not a static camera. And there's a variety of capabilities. It is a platform that's very open. There are a number of vendors that have come to us that have video analysis capabilities to look at kinetic movement and provide. So again, being at the point where care is needed and having the sensors and the various devices to really make it a meaningful extension of the existing care staff and reducing the administrative burden. So I feel we're well on our way of delivering our mission. And it's, I was asked last night, I think it was the top salesperson for Point Click Care.
Okay.
I forgot his name, but he said, "Did you invent this or create this?" And Rachel standing right there, and I looked at her and I said, "No, I was a catalyst to help it happen, but the nurses really developed, designed. We build it, but we build it based on feedback and guidance. I'm just happy to be part of this process.
Yeah.
I think that kind of sums it up."
Right. And I think that's pretty critical, right? When you have an idea, then we needed to have the people in the trenches to see how it's applicable to the real life.
Mm-hmm.
And sometimes is that those moments wasn't captured early. So while people develop some type of solution, it doesn't quite fit. And then they wonder why we have so much trouble with adoption, retention. Once people on board, whether it's patient or the clinical staff, how come people stop using it after the initial excitement where it is? versus you guys have adapted into exactly how the nurses will take care of the patient. So with the application of, perhaps it's not emergent, they need something,
right.
We can send robot while the nurse is taking care of someone else, where they need to just sit down a minute, put all the orders sorted out, see what's happening, and then they have this moment. The only thing I would think about is how what's the ratio looks like, right? So in those situations, is it faster, quote unquote, for the people to run to the room to do this versus have the robot to dispatch room A, B, C simultaneously? So what does that experience look like?
Yeah, the beta client we've just released that we're working with, we see it as part of the rounding primaries. So the nurse is moving and CC's with them.
Yeah.
In a case where the nurse is in a center and going to dispatch CC, the speed can be adjusted in terms of its movement. And if it's more, and we stress this too, people helping people, that's what we're trying to free up. So more of that happens.
Yeah.
So if it makes sense that maybe there's administrative tasks this person would have to be doing so they couldn't get to see Mrs. Smith.
Right.
Now that task has been lifted and they're able to respond in person. Then that's a win. So we really look at how can we free up time? What are those things that we can free up that are helpful? And the analysis that we've done and feedback we received, anywhere per shift between 3 and 5 hours of time freed up.
That's amazing.
And that's 3 shifts, or 365 days a year. The return on the investment based on just that kind of metric is within a month. It's. We also went to market. Our pricing point is some say we're leaving money on the table. I don't subscribe to that. Our modus operandi here is how can we remove as many barriers as possible to adoption, right? To create, not only is it a helpful tool, don't take it away from me because I need it. We've now are in a situation, right, by utilizing it, our staff are able to cover other areas which are very critical. So if you pull that out, then I can't do those other things, right? So to get there, one of the points that we did was our price point for CC is $10,000 to buy it. Our closest competitor that doesn't do nearly what we're talking about to buy theirs is about 35, starts at 35, goes up 1,000. And this is Rachel.
Hello. Hi, Rachel.
Rachel has CC with her.
We're here with Rachel West. I was so excited to hear more about you guys at vCare for leveraging robot to help us reduce the amount of work as clinical staff are doing. And as John mentioned earlier, when we got so caught up with just documentation, we got lost with the true patient interaction.
Absolutely.
And also it put on the burden on all of us who are leaving the field of medicine.
Yeah.
And I was burned out doing cardiothoracic surgery years ago, now backing away from it because I stepped into more of a leadership and innovation role of being the right connectors of what do we need as clinical staff, the solutions, because there's a difference between hospital-based, outpatient-based, short-term care, long-term care, and then bring all these amazing solutions such as vCare to the right sectors. Because in innovation, a lot of time it seems like we want to solve everything, right? Because have so many applications. But once they narrow down, what is the easiest field for us to have impact now? Not to say this vision is there, but then if you take 10 years to do it, how many people are really going to wait for that to happen? And that's very difficult for both the investors, as some of us who wear our VC hats, versus the hospital leaders, community leaders, of are you going to sustain it long enough to actually do something for us? Right?
And the patients are residents too. I mean, nobody's really being served, unfortunately, right?
Yeah. If we can't make any forward movement, then we're just simply getting stuck or sometimes even going backwards.
Absolutely.
as you're guys are involved with vCare, now you have an amazing clinical background. You do really shaping the pathways and applications. So tell us a little bit about some of the ways that you have been seeing in
more for which segment, which setting this is best used for.
Sure. Yeah, that's a great question. And I think one of the things that I am so excited to be part of vCare Companion, I'm a nurse forever now. It feels like forever. Time goes quickly. One of the things I like about CC, our robot, and the tools that we're building is that they are very malleable. So what I mean by that is that absolutely there's a direct link and benefit for our long-term care partners, our assisted living partners, but I honestly see a place for her everywhere. I see her in the community. I see her in hospitals, I see her in clinics. I think about rural health a lot, places that don't have quick, easy access to providers. I think from a provider perspective, being able to access your patients is huge. From a nursing perspective, not being bogged down by all the tasks and things that need to be done to go back to doing the things that I really always wanted to do as a nurse. I was in an ICU and there's a lot of technology in an ICU, not all designed by a nurse, very clearly, right? Well-intentioned, no problem with that. Obviously everyone wants to do the right thing, but being able to be part of this from its beginning and right away say, oh yeah, no, that's not going to be helpful for a nurse, or have you thought of this? And this really is going to be a benefit for nurses. It's really empowering.
Great. And then what I learned is to have the application of reducing where we have to have the movable computer system and our vital machines and all the different gadgets. This is all in one brand. Do all your monitoring, you have a visualization of seeing patient movements. So it's, and she follows you around.
She sure does. She sure does.
We don't even have to push and pull to get something over the home. She does need a little how the ways going over a curve.
No. She's very, she's built to be very safe so that she doesn't trip anybody or fall down. She'll just stop. If she thinks that the floor is a cliff or she thinks she's going to fall down, she just stops. And she's built that way on purpose to protect her and everybody around her.
Yes. Now, currently, how many facilities you guys are in, and mostly at the short-term?
Right. So right now we're in long-term care. So we're just launching. This is our world premiere right here at Lake Picture Summit. So we've had a client that's worked with us to really get us to this point, to really help us develop the integration and build the back end the way we need to. And we're in the process of developing and gathering our early adoption partners. We really want to, highlight people who really want to work with us to put the final finishing touches on it to make it truly transforming care. We're really just after making this better.
Yeah, that's exciting to see.
So,
how many users do you have when you do the early trials?
So the company that we're working with, they have 28 buildings and 10,000 residents in it. So, they're a pretty big facility. We want to start, I know that isn't a small number or a small facility group, but the way that we approach this is because adoption and truly enmeshing with the organization is so important. We really take a staged approach. So there's a unit that really wants and is excited for innovation, really wants to make a difference. We partner with them, really get to know them very well, and then broaden that out to the public.
Yeah. So what's the goal for the rest of 2025? We have 3 more quarters to go. How many facilities do we want to implement?
All of them. Is that another answer?
We, in our front log of activities, we were at the Vive conference weeks ago in Nashville. We had 5 groups that are very serious about early adopter program and intervention. Our target is to get to 12 communities. We need
unique entities. It could be multiple communities by the end of this fiscal year, 2025. We already have in process projects started with the largest healthcare company in the world. You mentioned them. We can't get till it's official.
Yeah.
But they have 10,000 locations, and they have a team now that are focused on integrating us into that space, into this. And they're looking at it from an inventory, keeping track of what's where, so staff would be able to better manage their resource and time. And that's just the beginning of the application area. We have another group that's based in Florida. We're in the process of finalizing a master services agreement, and they support long-term care throughout the U.S. They have a very strong relationship with the state of Florida, and they look at CC bringing real value to those operations. They're telling us they're looking at this becoming a standard for the long-term care environment they work with, and also the acute care space that they're involved in. And their unit count is north of 2,000. So we're talking quite a number of these. And we're excited about that kind of partnership because they have relationships. And from a valuation point of view, this is the owner opportunity. Every day these things happen, our value increases. So we do have, and this could be a segue for another time, but we do have an activity right now for Series A. This fiscal year will end between, depends on how many the initial unit rollout will be for one of these groups, but we'll end at about $2.5 to $3 million. So, we've done it very carefully. We've used our own money as much as possible to get some seed money in that helped. What's the word we use? The money is very passionate to our mission, which is important, right? The alignment.
Yeah.
So, I am, and the other co-owners are, sensitive to the Series A. So we have a whole deck of detail regarding that mission, technical roadmap, as well as how we see scaling. This is exciting. And the reason Rachel and others get drawn in is it really doesn't. This is not, and I've been involved with technology all my professional career, and I've seen technology forced into situations that it never lasts. It hurts. We talked about that earlier. This is truly something. And I like the fact, I love the fact that nurses are involved from the beginning, that is going to make a real difference to their lives. More time, hopefully, to come home to enjoy their families, better care for the staff, for the residents, as well as the patients. It just aligns in so many ways. And as I said earlier about the price point, we brought it down as low as we could, make sure we have sustainability. And I think, I'm hoping we've hit the sweet spot where adoption will be using it from that perspective. So the timing of you reaching out was really interesting. I think there will be more conversation.
Yeah, and it definitely is the point of you guys are launching. We have a big tool that's already validated. I think that's what we love. It's this is not a new product without a user that's barely there, right? And then because some programs, their user base is there's 50 patients. That's still great.
That's great. Yeah.
Now, when you are able to work with a facility with thousands, that big point, and then having these early adopters that potentially become champions, for sure, it's huge, especially for Series A, where we start wearing the VC out. Looking at Series A, we wanted to see that revenue start growing. Validation, and because it's not so much about money, it's more like proof of concept.
Yeah.
If people want it, they're willing to pay money for it. That's when you pay nothing, people don't see value.
Oh, for sure.
Yeah. So you to be able to have this relationship with the clinical side, and we saw this long-term care. We have different vibe outside of
really?
Yeah. So we usually cover vibe as well. And we yourself in the right place. And as John mentioned, there could be application for even in-home.
Oh, absolutely.
Right?
Absolutely.
But we have to start somewhere.
Absolutely. Yeah.
And perhaps that's the next 3 years plan.
Absolutely.
You really expand getting our foot in the ground and see how we quickly adapt by purchasing the units and I'm assuming there's an additional subscription.
There is. You can actually, if the price to purchase CC is too high, there is a leasing option as well. That if you don't have a big chunk of cash, not that it's so big in terms of our competitors and things like that have significantly higher barriers to entry. Even if that is too much, there is a subscription that you can just rent.
Yes. And there's a lot of excitement out there. I'm sure as we start getting interest, as you start launching, getting the first few, right? The promising ones, and then add click care, more conversation, more interest into it. As the next quarter rolls around, I think that's the big push. Let's close this contract and let's implement, and then by the end of the year, then it's the 12 different facilities. So it's very exciting. It's fun to be in the space. Usually my last question. So if I give you a magic wand and you can grant yourself 3 wishes to make vCare even bigger than what you can imagine at this point right now, what would you use the 3 magic wands for?
Well, I know as a kid, whenever we're asked about the 3 wishes, my first wish is to get 100 wishes. But I won't do that here. But it's kind of like that. I think capital, we have a vision that does require capital. What the capital be used for? Well, we're scaling. We're beginning a new way to look at how healthcare gets delivered. So we just talked about enabling conversation capabilities. There is medication delivery. There is in-home patient care. There is a variety of configurations that we would build. We see onshoring based on the numbers, robotic current here. And I think, so that's on the structural side in terms of and with that, we see the development of, as Rachel and I talked about it, our view of sales is not the traditional view. Nurses are our salespeople. Nurses are the heroes. Nurses are going to be the trusted advisor. So our view is to build up a group of nurses that are part of our team, that have core expertise sets, and are able to talk to their peers, share their experiences. So we've been investing in that. It's a very important piece of this. And we've also talked with the European environment, the British healthcare environment. There's demand and interest there. So we would develop ourselves looking at the workflows and challenges. We have a meeting coming up in about a month and a half time. One of our board members, Dr. Kinney, is meeting with the Union Health Administration. They're looking at ways to provide efficiency of delivery. So they are very interested in what they're doing. And that can be exciting. But it's going to be building up expertise sets around, for example, lab. We mentioned lab earlier. There's a whole collection on protocol in terms of how that's done. We would take a look at that and see how we can automate, not necessarily the machines that do certain processes, but the people that are interacting and have to get the data to where it needs to go, etc. So if robotics can fit there, if there's an option for us to do lift, then we'll focus on that. And that really is impressive.
Yeah.
That's my big one.
Yeah, big one is let's get more funded to kickstart, hire more people, get more of CC developed so we can really put in the right hands of the patient, the facility, and let's change the way that we think about what the growth next phase looks like, and then be able to integrate some of the solution we know is difficult is sending the right information to the right people, processing, and some of the conversation that I even heard is even you order a lab that doesn't get sent out correctly, or it takes a very long time for the results to come back. So that delays how we make clinical decisions. And then people, when they're waiting around, when they're unsure what's happening, that creates additional fear. So this is really the next phase of can we have the magic to do the good things, but focusing on the right now is getting those initial early stage champions.
I think you said it well. You just actually tied into another thing. CC has a facial recognition capability. One of the challenges in pharmacy delivery is you don't actually know if the med was consumed.
Correct. Yeah.
CC will be a little API in the machine.
Oh, nice.
So that's just, it's possible to deliver medications on different configurations.
Yeah.
So again, building those different capabilities in a platform that allows us to do so, which we validated. We're so grateful for us, which is our initial client that we work with, to give us those resources and faith and trust that this is something worth doing. And we're about to start having their teams begin to move on forward into action. We have another group that they're asking us to do it. We want to, I'm getting back to something you said earlier, which is so true. We need to make sure that you have the right input before you march off and present this decision. And so we're getting feedback now from these early adopters.
A series of roundtable discussions with nurses from around the country, actually internationally as well, to provide feedback on how we're designing the software component of this and really starting to truly transform the way healthcare is delivered. I mean, I don't feel like that's overstating when you're thinking about CC. She really is going to help us reshape, help us resolve some of the challenges that we have in our ecosystem.
So having a good capital market that help us in this is going to really make a big difference. A big difference on the trajectory, the speed of adoption, the good that we can generate.
Yeah. That's very exciting. So for everybody who's interested in this space, especially if you're in long-term care right now, thinking about how to cut down the amount of time your nurses are taking care of your patients, so they can focus on more critical tasks and being able to have better integration and check out here. And for John, what's the best way for people to reach out to you?
Sure. Reach me through LinkedIn, Jonathan McCoy. And vCare is on there as well. My email is jonathan@vcarecompanion.ai. And is there anything else I should say? Yes. I don't think I want to get my cell phone.
Yeah, one.
That'll get me.
Yes. LinkedIn and email. Definitely, we always say LinkedIn has been great for communication, for professional engagement, and as we all become individual brand, as also personal branding, right? Like you are as a leader in this space, then also representing the whole company, something that Rachel is doing. So it's a lot of different ways that we can truly promote and get the right eyeballs into this and make a change, right?
Thank you for your work to allow us to get the message out. Appreciate it very much.
Thank you for tuning in to Provider's Edge podcast. We hope you enjoy our latest episode and found the insights and tips helpful. We'd love to hear your feedback on the show and learn what topics you'd like us to cover in the future. So please take a moment to leave us a review on your favorite podcast platform and let us know what you think. Your feedback is essential to help us improve the show and provide you with the content you need to take your healthcare business to the next level. Thank you for your support, and we look forward to hearing from you soon.